As we age, our digestive system and overall health become more sensitive to certain foods. While vegetables are generally considered healthy, some can cause indigestion, affect blood pressure, or aggravate underlying health conditions in older adults. Identifying and limiting these vegetables can help older adults maintain better health. Here are 7 vegetables that older adults should avoid to ensure smooth digestive function and minimize potential health risks. 1. Should the elderly eat raw cruciferous vegetables? Raw cruciferous vegetables: broccoli, cauliflower, cabbage, Brussels sprouts. Cruciferous vegetables, including broccoli, cauliflower, cabbage, and Brussels sprouts, are a nutritious food source, providing vitamin C, K, fiber, and antioxidant compounds. However, for the elderly, eating raw cruciferous vegetables can cause some digestive and health problems. Why can raw cruciferous vegetables be harmful to the elderly? A. Causes bloating, and indigestion. Cruciferous vegetables contain a large amount of insoluble fiber and raffinose, a type of carbohydrate that is difficult to digest. When entering the intestine, raffinose is not completely absorbed by the body, but is fermented by intestinal bacteria, creating gas and causing bloating and flatulence. Elderly people often have weaker digestive systems, less enzymes to help break down fiber, leading to indigestion and bloating after eating raw cruciferous vegetables. B. Affects thyroid function. Raw cruciferous vegetables contain goitrogens, compounds that can affect the body's absorption of iodine, causing impaired thyroid function if consumed in excess. For elderly people with thyroid disease, especially hypothyroidism, eating a lot of raw cruciferous vegetables can aggravate this condition, causing fatigue, weight gain, and metabolic disorders. C. Increased risk of indigestion and intestinal disorders. The digestive system of the elderly works more slowly, reducing the ability to digest foods high in hard fiber, such as raw cruciferous vegetables. If eaten too much, it can lead to constipation or diarrhea due to overstimulation of intestinal bacteria. How to eat cruciferous vegetables safely for the elderly. Despite some negative effects, cruciferous vegetables are still very good foods if prepared properly. Here are some suggestions for the elderly to eat cruciferous vegetables without worrying about digestive problems. White heavy checkmark: light cooking. Steaming, boiling, or lightly stir-frying helps break down compounds that cause bloating and reduces the effects of goitrogens on the thyroid gland. White heavy checkmark: eat in moderation. Do not eat too much in one meal. Divide the amount of vegetables consumed during the day so that the body can easily absorb them. White heavy checkmark: combine with foods that support digestion. Eat cruciferous vegetables with ginger, garlic, or yogurt to stimulate digestion and reduce bloating. White heavy checkmark: avoid eating when hungry. You should eat cruciferous vegetables after main meals or with starch to limit excessive stimulation of the intestines. White heavy checkmark: listen to your body. If you experience bloating or discomfort after eating cruciferous vegetables, you should adjust your intake or change the way you prepare them. Conclusion: cruciferous vegetables are nutritious foods, but can cause some digestive problems if eaten raw, especially in the elderly. To reap the benefits without risk, the elderly should eat cruciferous vegetables cooked and consumed in moderation. If you have thyroid disease or chronic digestive problems, you should consult your doctor before adding them to your daily diet. 2. Spinach and its effects on the health of the elderly. 1. Spinach, also known as spinach, is a very nutritious green vegetable, often recommended in a healthy diet. This vegetable is rich in vitamins A, C, K, folate, iron, and important antioxidants, which help strengthen the immune system, protect the heart, and support bone and joint health. However, spinach also contains high levels of oxalate, a compound that can negatively affect the health of the elderly, especially those at risk of kidney stones. 2. Oxalate in spinach and the risk of kidney stones. What is oxalate? Oxalate, oxalic acid, is a natural compound found in many foods, especially green leafy vegetables such as spinach. When entering the body, oxalate can bind with calcium to form calcium oxalate crystals, the main component of kidney stones. Why should the elderly be careful with oxalate? Higher risk of kidney stones. Elderly people have impaired kidney function. If they consume a lot of foods rich in oxalate such as spinach, it can increase the risk of kidney stones. Reduced calcium absorption. Oxalate can interfere with the absorption of calcium in the body, leading to calcium deficiency, a concern in the elderly due to the risk of osteoporosis. Affects the digestive system. Some people with sensitive digestive systems may have difficulty metabolizing oxalate, causing problems such as bloating and indigestion. 3. How to reduce the risk of oxalate effects in spinach. Although spinach has many nutritional benefits, the elderly can still consume it safely by applying the following measures. Cook instead of eating raw. Boiling or steaming spinach can reduce the oxalate content by up to 30 to 50%. Combine with calcium-rich foods. Calcium from foods such as milk, cheese, yogurt can help reduce the absorption of oxalate in the intestine, thereby limiting the risk of kidney stones. Drink enough water. Drinking plenty of water helps dilute oxalate in urine, reducing the possibility of kidney stones forming. Limit excessive consumption. The elderly should not eat spinach every day but should alternate with low-oxalate vegetables such as spinach, broccoli, and pumpkin. Regular health checkups. If you have a history of kidney stones, consult your doctor about a suitable diet. 4. Conclusion. Spinach is a nutritious vegetable, but it is not always good for the elderly, especially those at risk of kidney stones or calcium deficiency. Using spinach properly, combined with a balanced diet and drinking enough water, can help take advantage of the nutritional benefits without negatively affecting health. Backhand index pointing right advice. If you are an elderly person or are caring for an elderly person, adjust the amount of spinach in your meals to ensure the best health. 3. Beets and kidney stones. What seniors need to know. 1. Introduction to beetroot. Beets are a nutritious root vegetable, often used in dishes and juices for their attractive color and natural sweetness. They are rich in vitamins, minerals, antioxidants, and have many health benefits such as supporting blood pressure, improving blood circulation, and enhancing brain function. However, beets also have a significant drawback for some people, especially seniors. High oxalate content, which can increase the risk of kidney stones. 2. Why can beets cause kidney stones? 1. High oxalate content. Beets are one of the foods that contain a lot of oxalate, a natural compound found in many plant foods. Once in the body, oxalate can combine with calcium in the urine to form calcium oxalate stones, the most common type of kidney stones. If you consume a lot of oxalate-rich foods like beets without drinking enough water or not controlling your calcium intake, the risk of kidney stones will increase, especially in the elderly, a group of people whose kidney function declines over time. 2. Effects on the elderly. Reduced kidney function. As you age, your kidneys function less effectively, making it more difficult to remove oxalate from the body. Digestive and metabolic changes. Older people often absorb calcium less well, increasing the possibility of oxalate combining with calcium in the kidneys, instead of being excreted through the intestines. Risk of dehydration. Older people often feel less thirsty and may not drink enough water, which makes urine more concentrated, creating conditions for kidney stones to form. 3. Symptoms of kidney stones. If you eat a lot of foods rich in oxalates such as beets without control, the elderly may experience symptoms of kidney stones such as back pain or hip pain. The pain can be severe, spreading to the lower abdomen. Painful urination, burning urination, uncomfortable feeling when urinating. Urine is pink, red, or brown, due to stones rubbing against the urinary tract, causing bleeding. Nausea or vomiting, Due to urinary tract obstruction, fever or chills. When there is a urinary tract infection due to kidney stones. If these symptoms appear, the elderly need to see a doctor immediately for appropriate treatment. 4. How to eat beets properly to reduce the risk of kidney stones. Although beets can increase the risk of kidney stones, not everyone needs to completely eliminate this food. The elderly can apply some of the following measures to minimize negative effects. 4.1. Limit the amount of beetroot consumed. If you have a history of kidney stones or are at high risk, reduce the amount of beetroot in your diet. Do not eat beetroot every day or use beetroot juice too often. 4.2. Combine with calcium-rich foods. Eating calcium-rich foods, milk, cheese, yogurt, salmon, etc. with meals containing beetroot helps oxalate combine with calcium in the intestine, reducing the ability to absorb into the blood and go to the kidneys. Do not use calcium supplements without a doctor's guidance, because excess calcium can also contribute to the formation of stones. 4.3. Drink enough water. The elderly should drink at least 2 to 2.5 liters of water per day, unless there is a medical condition that prevents drinking a lot of water, such as heart failure. Water helps dilute urine and prevents oxalate from crystallizing into kidney stones. 4.4. Eat a variety, don't just rely on beets. Replace some of your beets with low-oxalate vegetables like pumpkin, carrots, and cabbage to ensure nutrition without increasing the risk of kidney stones. 5. Conclusion. Beets are a nutritious food with many health benefits, but for the elderly or those at risk of kidney stones, caution should be exercised when consuming them due to their high oxalate content. By eating a balanced diet, getting enough calcium from food, drinking enough water, and regularly monitoring kidney health, the elderly can enjoy the benefits of beets without worrying about the risk of kidney stones. If you have a history of kidney stones, consult your doctor before adding beets to your diet. 4. Eggplant and its effects on the elderly. Why? Eggplant is a common vegetable in the daily diet, but for some people, especially the elderly, it can cause side effects. The main reason is that eggplant contains a compound called solanine, a natural alkaloid that can cause irritation in some people, especially those with arthritis. 1. Solanine and its effects on health. Solanine is a natural compound found in many foods in the Solanaceae family, including eggplant, tomatoes, and potatoes. Although the solanine content in eggplant is quite low compared to potatoes, for people with sensitive constitutions, especially the elderly, solanine can cause some health problems. 2. Effects of solanine on arthritis. Solanine can irritate the nervous and immune systems, leading to increased levels of inflammation in the body. For people with arthritis, including rheumatoid arthritis and gouty arthritis, consuming foods containing solanine can aggravate arthritis symptoms, causing pain and swelling in the joints. These symptoms can make it difficult for older adults to move around and reduce their quality of life. 3. Elderly people and the digestive system. Older people often have sensitive and easily irritated digestive systems. Consuming foods containing solanine can cause problems such as bloating, diarrhea, or digestive upset. In addition, solanine can affect the ability to absorb important nutrients, which is especially important for older adults, who need to ensure adequate intake of vitamins and minerals. 4. Warning signs. If an older person experiences signs of arthritis problems after eating eggplant or foods containing solanine, they should consult a doctor. Symptoms may include joint pain and swelling, stiffness, especially in the morning, increased inflammation or redness around the joints. 5. How to reduce the harm of eggplant. While eggplant may not be suitable for everyone, if an older person still wants to enjoy eggplant, there are some steps that can be taken to reduce the effects of solanine. Cook eggplant thoroughly. Cooking eggplant at high temperatures can help reduce solanine levels. Remove the skin. Eggplant skin contains higher levels of solanine than the flesh inside, so removing the skin can reduce the risk of irritation. Brine. Before cooking, eggplant can be soaked in salt water to help remove some of the solanine. 6. Alternative food choices. If eggplant is a problem for seniors, they can replace it with other vegetables that are beneficial for joint health and easier to digest, such as carrots, rich in vitamin A and beta-carotene, which helps support eye health and the immune system. Spinach, high in antioxidants and vitamin K, which support joint health. Squash, an excellent source of vitamins A, C, and minerals that help reduce inflammation. 7. Conclusion. Although eggplant has many nutritional benefits, for seniors, especially those with arthritis, eggplant can cause unwanted reactions due to its solanine content. Understanding the potential effects of solanine and choosing appropriate cooking methods will help reduce the harmful effects and maintain better health for seniors. However, if you experience unusual symptoms after eating eggplant, the elderly should seek advice from a doctor or nutritionist. 5. Raw onions and garlic, causes of heartburn and indigestion. Why is that? Onions and garlic, although common spices in many dishes, can cause digestive discomfort, especially for the elderly, especially those with gastroesophageal reflux disease (GERD). 1. Ingredients and effects of onions and garlic. Onions. Onions contain a lot of fiber and natural sulfur compounds, which are beneficial for health. However, when eating raw onions, these compounds can increase the secretion of stomach acid, causing heartburn, reflux, or bloating. Garlic. Garlic has antibacterial, anti-inflammatory, and immune-boosting effects. However, like onions, garlic can stimulate the production of stomach acid, increasing the risk of heartburn and reflux, especially when eating raw garlic. 2. Effects of onions and garlic on the elderly. Indigestion and heartburn. Elderly people often experience digestive problems, such as decreased stomach acid production or lower esophageal valve function. Therefore, eating raw onions and garlic can increase the acid level in the stomach, leading to heartburn, bloating, or acid reflux. Gastroesophageal reflux disease. GERD people with GERD may find their condition worsen by eating trigger foods like onions and garlic. The ingredients in onions and garlic can relax the lower esophageal sphincter, LES, which is the muscle that helps prevent acid from the stomach from flowing back into the esophagus, leading to symptoms such as chest pain, difficulty swallowing, or coughing. 3. Signs to watch out for. If older adults experience the following signs when eating onions or garlic, they should pay attention and consider eliminating them from their diet. Pain in the chest or throat, feeling nauseous or full, difficulty swallowing or feeling of a lump in the throat, persistent heartburn or discomfort after eating, regurgitation of food or gastric juices into the mouth. 4. How to use onions and garlic safely for the elderly. Although raw onions and garlic can cause problems for some older adults, they can still be used safely by cooking onions and garlic. Cooking onions and garlic will reduce the stimulating effects of sulfur compounds, helping to reduce the risk of heartburn and indigestion. Reduce intake. Limiting the amount of onions and garlic in meals can help control digestive symptoms. Older adults can partially replace raw onions and garlic with other less irritating spices. Careful preparation. In addition to cooking, older adults can also use cooking methods such as stir-frying, steaming, or baking to reduce the impact of onions and garlic on the digestive system. 5. Alternatives. If onions and garlic cause discomfort, older adults can try replacing them with other spices that are beneficial to the digestive system, such as ginger, has the effect of soothing the stomach and reducing bloating. Mint helps relax stomach muscles and relieve heartburn symptoms. Dill, often used to soothe the stomach and improve digestion. Conclusion: raw onions and garlic can cause digestive problems, especially for older adults or people with medical conditions such as GERD. Their consumption should be carefully regulated to avoid unpleasant symptoms. They should be cooked or replaced with other spices if necessary to maintain good digestive health. 6. Mushrooms. Why should the elderly be careful when eating? Mushrooms are a very popular food in dishes, but for the elderly, the consumption of mushrooms needs to be carefully considered. Although mushrooms provide many nutrients such as vitamin D, iron, fiber, and antioxidants, some types of mushrooms can cause serious health problems, especially for the digestive system of the elderly. Why can mushrooms be difficult to digest? Some types of mushrooms have a cell structure that contains chitin, an indigestible substance that the human body cannot effectively break down. When the elderly eat mushrooms containing chitin, their digestive system may have difficulty digesting them, leading to symptoms such as abdominal pain, bloating, diarrhea, and nausea. In addition, the elderly often have a weaker digestive system, and the ability to secrete digestive enzymes also decreases with age. So, although mushrooms can provide many nutrients, if not processed and consumed properly, they can become a cause of digestive disorders in the elderly. Mushrooms that are difficult to digest. Agaricus mushrooms. Some types of mushrooms contain compounds that are difficult for the elderly to digest. If not cooked properly, they can cause digestive problems. Shiitake mushrooms. Although known for their many health benefits, if eaten in excess or not cooked properly, they can cause digestive disorders and allergic reactions. Straw mushrooms and other wild mushrooms. These mushrooms can be very difficult to digest, and if not handled carefully or eaten, poisonous mushrooms can cause serious food poisoning. Risk of digestive disorders in the elderly. The digestive system of the elderly often works more slowly, making it more difficult to digest food. The negative effects of mushrooms on the digestive system can lead to bloating and indigestion. When the body cannot break down mushrooms properly, gases can build up in the intestines, causing bloating. Diarrhea. Mushrooms that are difficult to digest can speed up the movement of food through the intestines, leading to diarrhea. Abdominal pain. Mushrooms that are difficult to digest can irritate the stomach and intestines, causing abdominal pain or discomfort. How can seniors safely consume mushrooms? Prepare mushrooms properly. Always cook mushrooms before eating. Cooking not only kills bacteria and toxins, but also reduces the hardness of the chitin in mushrooms, making them easier for the body to digest. Choose processed mushrooms. Dried mushrooms are often easier to digest than fresh mushrooms. Buying processed mushrooms or mushrooms that have been carefully prepared will help minimize the risk of digestive problems. Don't eat wild mushrooms. For seniors, consuming wild mushrooms can be dangerous because they may contain toxins that are not visible to the naked eye. Wild mushrooms can also be difficult to digest and cause allergic reactions. Eat in moderation. Although mushrooms are beneficial for health, seniors should not eat too much at one time. Eating too much mushroom can overload the digestive system and lead to problems such as bloating, indigestion, or diarrhea. Choose mushrooms that are easy to digest. Some types of mushrooms, such as button mushrooms, cooked shiitake mushrooms, or reishi mushrooms, may be easier to digest. Choosing these types of mushrooms can reduce the risk of digestive disorders. Conclusion: although mushrooms can provide many nutritional benefits, seniors should be careful when eating mushrooms because some types of mushrooms are difficult to digest and can cause digestive problems. Properly preparing mushrooms, choosing safe mushrooms, and consuming them in moderation will help the elderly take advantage of the benefits that mushrooms bring without facing unnecessary health risks. 7. Chili peppers, bell peppers, and hot peppers. Why be careful? Bell peppers and hot peppers are foods that can have negative effects on the health of older adults, especially those with conditions such as acid reflux or arthritis problems. Here are some reasons why older adults should be careful when consuming these peppers. 1. Affects acid reflux. Hot peppers, including bell peppers, can increase the burning sensation in the stomach and esophagus. When consumed, these foods can irritate the lower esophageal sphincter, LES, causing it to relax and allowing stomach acid to flow back into the esophagus. This leads to unpleasant symptoms such as heartburn, chest pain, shortness of breath, dry cough. In older people, the ability to handle the effects of acid reflux can weaken, making symptoms more severe and affecting quality of life. 2. Effects of foods in the nightshade family. Chili peppers belong to the nightshade family of plants, along with tomatoes, eggplants, and potatoes. Studies have shown that some people may experience arthritis or musculoskeletal inflammation when consuming these foods. Compounds in the nightshade family, especially solanine, can increase inflammation in the body. This causes pain and stiffness in the joints, especially in people with a history of arthritis or inflammatory conditions. 3. Stomach and digestion irritants. Hot peppers and chili peppers can irritate the stomach, leading to digestive problems such as bloating, indigestion, and even diarrhea in some people. This can make older adults feel uncomfortable and reduce their ability to get adequate nutrition. 4. Indications for seniors. Although bell peppers are high in vitamin C and other beneficial nutrients, seniors should be cautious about eating them if they have problems such as acid reflux, arthritis, or inflammatory problems, gastroenteritis, or other digestive problems. If you are an older adult with such health problems, it is best to limit or avoid consuming hot peppers. If you are unsure whether hot peppers are appropriate for your diet, consult your doctor or dietitian. 5. Safe alternatives and preparation. If you still want to enjoy the taste of chili peppers, but don't want to suffer from the health problems above, you can consider some safer alternatives and preparation methods. Bell peppers instead of hot peppers. Bell peppers are a milder and less irritating option for the stomach than hot peppers. You can eat them raw, roasted, or prepared into easy-to-digest dishes, cutting down on the spice. If you want to keep a little spicy flavor in your dish, try replacing hot peppers with other spices like ginger or black pepper, as they are less irritating. Cooking thoroughly. Cooking peppers longer can help reduce the spiciness and make them easier to digest. In summary, although bell peppers and hot peppers can provide many nutritional benefits, older people with stomach or joint problems should be careful when consuming them. Always remember to listen to your body and adjust your diet accordingly to maintain the best health.